Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right. Good morning. Welcome back to Insurance Matchmaking. Just me again this week. Hopefully, I won't bore y'all too much. But one of the things kind of came up yesterday or this week with a new client, and I thought, that's something that might make sense for me to talk about on the show, because I was struggling with whether to recommend Medicare Advantage or Medicare Supplement for this client. So I know that's a question a lot of people have. We say there's three schools of thought. There's those agents that say you should only ever have a Medicare Supplement, and then there's those that say, oh no, you should have a Medicare Advantage. And then there's people like me that do both, because it's not there isn't a one size fits all with insurance. It's all individual, and I work to find the plan that's going to fit you or your loved one, whoever I'm helping out. One of the things I do like about Medicare is I help somebody figure out what route they're going to take with Medicare, and I get paid either way. Now, believe it or not, one way pays me more, and you'd be surprised that that's not the way that I generally recommend first. So let me get into a little bit of the differences, and then I'll tell you why or why not I might recommend one over the other. So if you've been on Medicare for a while, you probably have a Medicare supplement. That's what most people did. Medicare Advantage just came about, in the last couple decades. So people who have originally on Medicare never even heard about a Medicare Advantage, and then a lot of people got tricked into getting Medicare Advantage because and this was before I got into the business, but there was a lot of people just going out and signing people up on a plan. They thought it was a new supplement, and the problem there is, and it's a problem in knowledge more than practice, but a Medicare Advantage is not a Medicare supplement. And maybe I better define that. A Medicare supplement supplements your Medicare. That's why sometimes they are called Medigap, because there are gaps in Medicare. You have deductibles. And when you meet that deductible on Part B, which is your basic health care, Medicare only pays 80%. So there's a big gap of, if you have really high medical costs, things like cancer treatments and repeat surgeries to correct a chronic disease, those costs are really going to add up. And if Medicare is only paying 80% and you don't have anything else, you can't afford that 20%. So that's how Medicare supplement really helps. That also covers the Medicare Part A deductible. That's your hospitalization. Medicare Part A, there's a couple other things in hospice, transplants. Are some areas that are also covered under Part A, but generally when we talk about Part A, we're talking about that inpatient hospital. And you can be overnight in the hospital and still not be admitted to the hospital as an inpatient. That's a definition that Medicare does, and I'm not going to go into that today. But you may be there under observation. And it's not the hospital doing it on a whim because they want more money. It's not your doctor saying, or it's not because your doctor says, no, I don't want them admitted inpatient, or I want them. It's not up to the hospital or the doctor. There's criteria that Medicare sets out based on why you're in the hospital, how long you're going to be in the hospital, how much care you need. And then they turn around and say, okay, you are admitted in the hospital. But that's Part A. Part A this year has a deductible of $1,632. Again, if you didn't have a supplement, then you would have to pay that deductible if you're admitted in the hospital. It's not the bad thing with it is it's not an annual deductible. So if you're in and out of the hospital several times during the year, you could have that deductible a few more times. If there is a 60-day, I joke that, day 61, your warranty is null and void. But when you're discharged from the hospital, that $1,600 deductible doesn't apply if you if you return to the hospital within that 60 days. So, but those are those gaps that Medicare supplement covers. So that's a great fix. Right now, a Medicare supplement for someone turning 65, and depending on if they maybe qualify for some other discounts, and male and female is a little different price. But it can range from about $90 to $130 depending on the company you go with, and that's for what's called a Plan G. And I'm going to just kind of talk about Plan G today. I may get into Plan N. We'll see what kind of time I have later. The Plan G does everything that the Plan F did. If you've been on Medicare for a while and you have a Plan F, you probably understand that. But it doesn't cover that Part B deductible. There was a thing called the MACRA Act of 2018. It was a result of the Affordable Care Act that everybody on Medicare needs to be paying the deductible. So if you're on original Medicare, just A and B, don't do anything else, you have a deductible of Part B, and this year that's $240. Medicare doesn't pay for anything but preventive things until you've paid that $240 deductible, and then they pay 80%. So again, that's where that supplement comes in. People who were on Medicare prior to 2020 have what's called Plan F, and they don't pay that deductible. But if you look at what they're paying in premium versus what they'd be paying on a G, they're spending a lot more money. So they are paying for a convenience. But one downside about a Medicare supplement is they are medically underwritten. You have to medically qualify to get a Medicare supplement. It is not guaranteed issue. Now, there are conditions where it could be guaranteed issue, and one of the big ones is we call it guaranteed acceptance, because guaranteed issue means you qualified to get it guaranteed issue because of an event, like loss of other coverage, like you lost your group plan or the company you had went out of business. So that's no fault of your own. Then the government says that another company has to take that up. That's guaranteed issue. Guaranteed acceptance is when you first go on Medicare, get your Part B. It doesn't have to be when you turn 65. It's when you activate that Part B. You have a 6-month window where you can get any Medicare supplement you want, any company you want to get it from, and they can't ask you any of the health questions. So that's why I generally encourage people when they're turning 65 to really consider going that supplement route, because you're not going to have any of those additional costs. The Medicare Advantage plans, they're like an ACA plan. They're like your group plan. They are a health plan. They are guaranteed issue. You can change plans every year if you like, but if you go on a Medicare Advantage when you first turn 65 and a couple years later you're like, I don't really like this plan. I wanted to go see this doctor. They're not in network. I'm now getting, if you're like me, getting CPAP supplies. Well, CPAP supplies are durable medical equipment. And with a Medicare Advantage company, one, if it's in network, you pay 20% of the cost for anything you get durable medical equipment until you hit the maximum out of pocket for that plan. So that Medicare Advantage plan can be very handy, but I'm saying people get that. It's like, oh, I'm tired of getting nickeled and dimed on these different co-pays. I'd rather have that simplicity of, hey, I pay a monthly fee and I don't have to worry about it. The Medicare supplement will pick up that 20%. You're outside that 6-month window now. You're not given guaranteed assurance that you can get a supplement at that time, because you have to answer the health questions now, and you could be turned down. The other thing is you want to make sure if you do go on that supplement at 65, make sure you pick a company, and that's one of the things agents like myself can help you with, is finding that plan that's the rates aren't going to skyrocket after 2 years or 3 years or 5 years. Because what happens there is they get you in on a low introductory rate, their rates skyrocket, and then you say, well, I want to switch to this other plan that I can save $20 a month from what I'm paying now, or even more, depending on how long you wait until you decide you want to change. But you have to go through that health screening, and maybe you got diagnosed with something 2 years after you went on Medicare, didn't think about the fact that that prescription you're taking now is going to stop you from getting it. I actually had one client, it was about 2 years ago now, wanted to switch their Medicare supplement. They did get approved to switch, but it was at the higher level because of a prescription that she had been prescribed. And the problem was that drug is also used for Alzheimer's. And so it doesn't matter what you had it prescribed for, you're higher risk if you have memory issues. She had it for memory, but the doctor was trying to see if it, kind of helped boost her memory. In fact, she's not even taking it now, but she has taken it within the last 5 years. She was not eligible to get that Medicare supplement. So that's one of the downsides down the road. The other is a Medicare Advantage. It's a health plan. It takes over your Medicare. One downside of that is you still have to pay that current $174.70 Part B premium to have that Medicare Advantage, because you have to have both A and B, Medicare A and B, to get a Medicare Advantage. But you can get one that's zero premium, and it's a pay-as-you-go. And most of the plans out there right now, there's no copay to go see your primary doctor, so that's handy. And the copays for specialists usually aren't too bad. But things like MRIs, a few days in the hospital, outpatient surgery, those can be some higher copays. And again, that's when people kind of run into like, oh, I'm running into all these copays. I want to go to supplement. Well, there's a reason you're having all those copays, because you have some health issues now, so you may not be able to switch. So a lot of people go for and there's where you get the extra benefits. You get the dental and vision benefits. You get the over-counter benefits. You maybe get a food card. You get hearing aid benefits. All those things that don't come with original Medicare and don't come with a Medicare supplement, you get those extra benefits. Oh, and by the way, your Part D prescription drug plan is included in that Medicare Advantage plan, all in one plan. I say that to bring up why I was struggling with what plan to recommend for this new client, and it has to do with those costs. I'm going to say one thing here before we get to the break. It's counterintuitive, but when I'm recommending someone go ahead and pay a little bit more money, get their Medicare supplement, pay a separate drug plan, and maybe pay separate for a dental, vision, and hearing plan, they're going to be paying more out per month. And typically you think commission. The more money you spend, the more commission that agent's getting. I actually get paid more if someone's brand new to Medicare and gets that zero premium Medicare Advantage plan than going the old route of the traditional Medicare supplement with a separate drug plan. So, and I tell people that. I say it in my Medicare 101 briefings. I said it with this new client. I'm not recommending that you pay more so I can get paid more. I'm actually going to get paid more if you take the zero plan. So I'm not pushing you because I'm going to get paid more. I'm suggesting because I think it's a better fit for you. So with that being said, after the break, I'm going to go into explaining why I was struggling with what to do with this client, and maybe somebody that's in a similar situation that I can help. So hopefully this will be very informative. And we're going to pop out for the break, and we'll be back for more Insurance Matchmaking.
Start this new spring season by treating yourself to that X-Mark you've been dreaming of and mow like you've never dreamed this spring. Right now at Gentry's Power Equipment, get instant rebates on select models and up to $700 or special financing of 0% for 54 months. Gentry's Power Equipment, 755 Buffalo Valley Road, Cookeville, where big boy toys are their specialty.
Are you ready to make a difference in your community? Join the Putnam County Sheriff's Office as a corrections deputy. With competitive pay ranging from $38,000 to $58,000, yearly step raises, and great benefits like health insurance and retirement options. This is a career you won't want to miss out on. Apply now at putnamcountytnsheriff.gov and start your journey towards a rewarding and fulfilling career in law enforcement. Don't wait. Make a difference today.
Hello, this is Mark Gaw, your local Twin Lakes Business Solutions consultant. As weather warms up, it's easy to let your guard down, but we're here to ensure your business stays on track. Explore Twin Lakes customized solutions designed for your business of every scale. Experience lightning-fast fiber broadband speeds up to 10 gig, dependable phone and conferencing services, and round-the-clock tech support to keep your operations running smoothly. Don't let your business miss a beat. Reach out to me today at 931-823-5511 or visit us online at twinlakes.net.
Looking to spruce up your home without breaking the bank? Visit Habitat Restore for incredible deals on furniture, appliances, home decor, and more. Plus, when you shop at Habitat Restore, you're not just getting great deals, you're also supporting your local community. Are you looking to make a meaningful impact? Consider donating to Habitat Restore. Your generosity can make a world of difference. Habitat Restore, open Tuesday through Saturday, 10 a.m. to 6 p.m. and located at 560 South Jefferson Avenue in Cookeville.
Exciting news! Grooming is back at Dog & Company here in Cookeville. Pamper your furry friends with their professional grooming staff while they enjoy their daycare or boarding stay. From baths to trims, they'll keep your pups looking and feeling great. Grooming appointments are booking now. Simply call 931-528-BARK. That's 931-528-BARK. Or swing by 1321 South Jefferson Avenue here in Cookeville. Dog and Company. Enjoy life and spoil your pets.
Coming to Brushy Mountain Saturday, May 25th, Oliver Anthony. Tickets $35. Gates open at 6. Show starts at 8. Free parking. Come early, tour the prison, visit the museum and gift shop, and grab a bite in the restaurant before the show. Get your tickets at tourbrushy.com. Craving a culinary adventure? Discover the excitement at Trackside, Cookeville's food truck park at 172 West Broad Street, just west of the depot. A casual, open-air culinary oasis in downtown Cookeville. Enjoy mouth-watering food, fun, and a vibrant atmosphere, including live music and entertainment. Whether you're a foodie or just hungry, Trackside has something for everyone. Open Wednesday through Saturday at 11 a.m. Visit TracksideCookeville.com for more information. Trackside. Come hungry, leave happy. Now through June 4th, Cumberland County Playhouse presents Dial M for Murder. Passion, blackmail, and revenge combine in this breathtaking murder mystery as a jealous husband's perfect crime misfires, trapping everyone in a sinister and dangerous web of lies. It's filled with shocking surprises that will keep you guessing until the very end. Don't miss Dial M for Murder, rated PG-13 and co-sponsored by Willow Cafe and Catering and Cumberland Legacy Law. Call 931-484-5000 or visit ccplayhouse.com today.
Hey there, this is Jeff Root, General Manager at Ford Lincoln of Cookeville. We love our local law enforcement community, which is why we are proud to announce our 2024 Clays for a Cause shooting tournament on Friday, May 10th. Gather your team for gun-toting fun to support the Cookeville PD, Putnam County Sheriff's Department, and Tennessee Highway Patrol. Your $500 team registration includes shooting fees, breakfast, lunch, and a cart rental. Call 931-526-3325 to register now. We can't wait to see you there.
Alert! Dinosaurs have been seen in Kentucky. At Dinosaur World in Cave City, Kentucky, you can wander around hundreds of life-size dinosaurs in a natural setting. Let your kids' imaginations run wild with interactive exhibits, dino-themed playgrounds featuring slides, swings, and all-around family fun. Swing by the 5,000-square-foot gift shop that offers cool prehistoric artifacts and gorgeous geodes. Book your unforgettable prehistoric experience online at dinosaurworld.com. Dinosaur World, 711 Mammoth Cave Road in Cave City, Kentucky.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and welcome back. And as I mentioned before the break, I've got kind of a case study I'm going to go over. Not using any names. We won't talk about what companies I recommended, but just the generalities of what transpired with this recent client and kind of give you an idea of maybe how I approach my business if you're thinking about needing some help or know someone that I maybe can help. So as if you listen to many of my programs, you know I do a Medicare 101 or Welcome to Medicare workshops that I offer at the library. Got a couple coming up this month. I forgot to have the dates up and handy, but you can go to the website, and they're on the website. We do have Crossville and the Cookeville Library, and has some of that money in the bank. And the other thing is, by cashing out that 401k, that is income in this year. She's already paid, she lost a bunch of it because it went to taxes, but that's income. And the reason I bring that up is one of the things that can be very helpful for those on a low fixed income is Social Security has a program. It's officially named low income subsidy, but they also call it extra help. And that has to do with the Part D prescription coverage. So you can be at a lower income, but not low enough income to qualify for Medicaid benefits or TennCare in our case. And there's a level in between qualifying for TennCare and qualifying for this help from the Social Security. If you qualify for TennCare or what's called SLMB, that's in between the TennCare level and the LIS, that will pay their Part B premium. If you qualify for either one of those, you automatically qualify for the Social Security program. So with that being said, based on her income, which she's drawing for Social Security, if that was her only income, she would have qualified for this program. Oh, there's another hoop to jump through. You also have a limit on how much assets or resources, as they call it, you can have. Now, the good news is your home, your car, those don't count. Those are assets, but they don't count against you in this calculation. The issue is if you have other resources. In her case right now, it's money in the bank because she cashed out that 401k to pay some things off, and she now has money in the bank, so she has resources. So that's one reason she's not qualifying, because of the resources. The other is it's going to be taxed as income. So she wouldn't qualify for the income this year because of cashing out that 401k. Next year, she should qualify. She's probably going to spend some of this money down, paying for other things, medical costs, whatever along the way, fixing up the house, fixing the car, who knows. It's her money. She can spend it how she wants. But she's probably not going to have that big lump sum in the bank at the end of the year, and she's not going to have that she rolled over that 401k money that spiked her income for this year. So next year, she should qualify for that low-income subsidy. So we should get back together in January and have her reapply for that. And at that time, probably makes sense to change her plans. But what happened was she's on the infamous Eliquis. If you're on Eliquis, you know exactly what I'm talking about. Eliquis is a blood thinner that a month's supply generally runs about $600. That is the actual cost that the insurance company says that's what this drug costs. And with Part D, that is a big deal because that's when that causes you to hit that coverage gap, or what's called the infamous donut hole. So even though she's starting later in the year this year, she's still going to probably hit that towards the end of the year just because of the cost. So that's a big cost. So what happens there is you have that standalone drug plan. Most of the time you're going to have a deductible because that's going to be what's called a Tier 3, a brand name drug. So that drug deductible is $545. So she would have to pay the first $545 before she even had a copay on that drug. So she knows she's going to be spending about $600 the first month that she gets that prescription. Or if she wants to get a drug plan that doesn't have a deductible, then she's looking at about $70 or more a month for that drug plan. So she's looking at spending $100, $120 on a plan G, another $70, $80 on a drug plan. So now she's at $150 to $180 just for her health plan and her drug coverage with no dental or vision coverage at all. Or does she get a Medicare Advantage where there's no drug deductible? It's a zero premium, because remember that $174.70 is coming out of Social Security also. So in her case, we went back and forth on it, that subsidy, so she can get it at a zero premium and then maybe spend that $100, $120 on a Medicare supplement and have that assurance that, hey, if my medical costs go up a lot, the Medicare supplement will cover it. Because I've had some individuals that are very poor. Basically, I recommend a Medicare supplement when you're turning 65 because of you have that freedom of movement, go to any doctor, go anywhere you want, have a great plan, and you don't have to worry about any networks. So generally, if you can afford it, that's a great way to go, and just knowing you're paying for coverage that you might not be using. I kind of compare it to your homeowner's insurance, your car insurance. You're buying insurance because you don't want to have a big unaffordable bill because something happens. That's why you have those insurance. It's the same thing with health insurance. In your Medicare supplement, that's kind of what you're doing. You're paying to protect yourself, just like with life insurance, you pay that your loved ones can have something after you're gone when you don't have a paycheck coming in anymore. The other thing is, if someone's definitely is already in poor health, had a heart attack in the last year or two, Parkinson's disease, recent cancer, diabetes, those are things I generally recommend. Hey, why don't you go ahead and get a Medicare supplement, if you can afford it, because of your health condition, you probably won't be able to get a Medicare supplement in later years. And if your health your health won't qualify for you to get a Medicare supplement, and you're getting eaten up with copays on an Advantage plan, that's just going to be the way it is. The other thing is with the Medicare Advantage, currently this year, the max out-of-pocket can be $8,300. I'm seeing kind of average around our area and most of Tennessee is about $3,900. Some are lower, some are higher. So if you kind of look at it that way, if you're in poor health, you're probably you're going to be more apt to be approaching that maximum out of pocket, and you just kind of do the math between what you're spending on your supplement and your drug plan, and just use a round number. If you're paying $200 for a Medicare supplement, and maybe Medicare supplement, dental, vision, and hearing, and drug plan, you're spending $200 for that combination. That's $2,400. That's what you're paying for your health care. Plus you add in the Part 240 Part B deductible. And you're still going to have copays for your prescriptions. That's going to get added on also. But if you go to the Medicare Advantage, and again, the drug costs don't go into that maximum out of pocket. But say you have a $3,900 maximum out of pocket, but you're getting durable medical equipment, you may be having repeat surgeries, you're having a lot of physical therapy, whatever, your medical costs are adding up. If your max out of pocket's $3,900, you're paying more for that zero premium plan than paying the $200 for the other package. So if you're going to have a lot of health issues hitting you, it's still going to cost you less to have that monthly premium than to have that zero premium plan. And I hope that makes sense. And again, that's why I tell people, yes, I may be asking you to, or recommending you spend more money here because you are going to have more coverage and it's going to cost you less in the long run. The same thing I tell people when they're looking at a drug plan. Do not pick your Part D drug plan solely on what the monthly premium is. I mean, there's a plan out there right now, 50 cents a month. I've written that plan for a lot of people, but it's not the right plan for everybody. I've got people that I've put on a $30 plan, a $50 plan, a $100 plan. Because of what prescriptions they had, that was the most economical way to go. If they'd taken that 50 cent a month plan, they might have had another $1,000, $2,000 in drug costs versus paying for a higher premium. So the premium is not your only consideration when you're looking at the plan. You have to look at how it's going to cover, how it's going to pay for your care. And if you're going to be facing a lot of health care costs and you're turning 65 or you're new to Medicare, that Medicare supplement comes in very handy. The other thing, before I run out of time, I would get a Medicare Advantage. I would recommend for most people get a Medicare Advantage at that point, and then when they turn 65, then consider a Medicare supplement, because the costs of those monthly premiums are just so much. And a lot of times you got the disability for something that happened and you're not able to work, but you're not having a lot of health care costs now. They happened in the beginning. So if you're not having a lot of health care costs, get the Advantage plan for now. And then when you're 65, you can get the supplement and go that way. Or you may stay on the Medicare Advantage. Most people that I have on an Advantage, even when they turn 65, I've had a couple of clients that recommend it. And again, it was the monthly premium, those monthly costs. It wasn't going to be worth it to them in their opinion. So again, until next time, we will see you on the radio. Go to insurancematchmaking.com for suggestions, questions, want to be on the show. And then the other deal is, if you're interested in the Medicare workshop, there's a link to my main website from there, and it's mattlibbyinsurance.com/WTM. That stands for Welcome to Medicare, and that has the schedule for those. So until next week, have a great week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.